There's a question about diabetes type 1 and type 2 and breath work. If you've ever wondered about the link between the two, there actually is. And the good news is a breathwork practice, more on the slower side of slow and deep breathing through the diaphragm at a slower pace, finding an optimum rhythm for you, that has been found to help lower blood glucose levels. In fact, they did a study, and there's been several studies that show that a breathwork practice can help in that progression of lowering blood glucose levels. But it also has to be included with an exercise program and a way of improving your diet. So you kind of begin to see that there is this way of eating and having a certain amount of mindfulness in the way you breathe and oxygen delivery to the system that all can make improvements to type 2 diabetes. Now in type 1 diabetes, I have a friend of mine, Nick Heath, who specializes specifically in type 1, as a type 1 diabetic, in teaching people mindfulness and breathing techniques and strategies for a type 1 diabetic rather than just relying on trying to get perfect numbers, which tells me that must be a psychological component mixed in with that for a type 1 diabetic for that kind of practice to be of benefit. So I would then go and research and talk to Nick, and you can seek him out online. And if you're interested in the area of type 1 diabetes, I know he could be a huge help to you on type 1. For type 2, I mean, it really comes down to changing eating habits long-term, changing your relationship with food, removing as much sugar as you possibly can from your diet, getting more movement. Of course, breath work, we know proper breathing mechanics will yield higher oxygen delivery to the cells and to the extremities, which we know is also a problem with type 2 diabetics, is the lack of oxygen to the extremities, I believe. And so that obviously better oxygen delivery yields better results when dealing with these types of situations.